Thank you. All right. So today we're going to be talking about loneliness and social isolation, why it's bad for our health, and what you can do about it. I'd like to also acknowledge the traditional custodians of the land, the Darug Nation, where I am, and leaders past, present, and emerging. I'll tell you a little bit about me. My name is Suraj. It rhymes with fudge, and it means the sun in Hindi. I have a master's and PhD in clinical psychology from the University of New South Wales here in Sydney, and I'm also a researcher at the university at the Center for Healthy Brain Aging. I also work 1 day a week as a clinical psychologist in private practice, and when I'm not being a nerd, I work as a music teacher. If you'd like to contact me about any of these things, my email is here. So as I mentioned, I'm a senior researcher at the Center for Healthy Brain Aging, and I'm very proud to work here. We are a self-funded research center based at the University of New South Wales, and we are internationally acclaimed in the research that we undertake to change the future of Alzheimer's disease and other dementias. We have a number of studies shown here on the screen that have lasted 10 to 15 years, which have provided a rich source of data to increase our understanding of healthy brain aging and dementia. Something that makes us stand out is that we are a multidisciplinary center, meaning we look at brain aging from all angles of genetics, environment, biomarkers, neuropsychology, neuroimaging, clinical care, and more. Ultimately, our vision is for all Australians to live out their lives unaffected by dementia. I'd like to thank the team that has worked with me throughout the project, the results of which I'll be presenting to you today, especially the support of Sally Mahalingam, who is our brilliant data analyst, and our two co-directors, Professor Henry Burdati and Professor Parminder Sachdev. So in today's talk, we'll be talking about social isolation and loneliness and their impact on our health, and what kind of social interactions promote healthy aging. We have the research to tell. What I want you to walk away with today is the knowledge of exactly what kind of social interactions we need and just how much do we need to stay healthy. So how do social interactions promote healthy aging? We'll be talking about that, as well as how we can promote being socially active for people in our community. So let's dive right in. Let's start by talking about social connections. We know that for the last 20 plus years, the number of social interactions we have face to face has been declining. Sorry, Jackie, did you have a question? I saw your hand up.
No problem, Raj. I'm just about to collate the questions as we go. Please continue.
Okay. So the other thing that we see is that loneliness is quite common in our communities, but you might be surprised to hear that rates of loneliness are actually lower among older adults in our community compared to other age groups. And this is consistent with a lot of research that tells us that as we get older, we have a superpower to focus on positive connections and positive people and interactions. And that's why we see this U-shaped curve of happiness in study after study. Wherever you do this happiness study in the world, you see the same thing. People are their least happy when they have teenage children, and they're the most happy in their 70s, 80s, and 90s. So when I see 20-year-olds come to me in the clinic and say, "Oh, I'm so sad, this is supposed to be the best years of my life," I tell them, hang on, you just have to wait for another 50 years. So I encourage you all to use this superpower and focus on the positive connections and relationships you have with those around you. Unfortunately, what we've been told to do is social distance and try to minimize contact with other people. I would have preferred if they used another term like physical distancing. The problem is that COVID's made rates of loneliness much worse. They have risen from about 6% to 21% since the pandemic. And this is understandable. In the clinic, I get three types of people. The first type of person was always really extroverted, socially active, and has stayed socially active. The second group of people withdrew from social interactions when the restrictions hit and now has started socializing again and attending community events, perhaps like all of you here. It's the third group of people that I worry about, people who withdrew from social interactions during that time and never went back, or people who just were lonely before the pandemic struck and it made things even worse for them. The problem with this is that as rates of loneliness creep up and rates of depression creep up and people lose the social supports they used to have, it increases our risk of getting dementia. So, what is dementia? It is an umbrella term that puts together over 100 different conditions, all of which affect our memory or other thinking abilities to the point where they interfere with our daily life. The most common type is Alzheimer's disease, where the first sign is memory loss. Next, we have Lewy bodies, which has hallucinations as its first sign. We also have vascular dementia, which is caused by strokes and affects different people differently because it depends on where the stroke happened in the brain. Then we also have frontotemporal dementia, which affects people's personality and mood so that they change from the person they used to be. There's many other types like Parkinson's and Huntington's, but most commonly what we see is mixed dementia, where people have more than one kind of dementia going on. In Australia, we have 421,000 people currently living with dementia, and this number is expected to double in the next 3 decades. Dementia is the leading cause of death for women and second leading cause of death overall. More than 1.6 million people right now are involved in the care of someone living with dementia. So it has a big impact on our well-being and on our society as well. So we need to do something about this. And that's why we have a vision to make sure that no one is affected by dementia here at CHIBA. So let's talk about the research on social connections for health. How do social connections help us to stay healthy? Let's start off with a story. This is someone who I saw in the clinic. I've changed her name, and this is not her picture for privacy reasons. We will call her Joanna. Joanna came to me and said that she had just retired. She said, "Look, I live with my husband. I've just retired, but all my friends used to be my work colleagues. Now I just feel so low every day. I don't feel motivated to do anything. I feel like I'm losing my memory. I'm losing my confidence. I just sit around all day and I don't know who to talk to. And nothing seems fun anymore. I just don't find anything exciting anymore." So I want you to keep Joanna's story in your mind because we will come back to that. And this will help you to think about the research that I'm going to show you now. The reason why we're looking at social interactions in the context of dementia is that it is one of the factors which can reduce our risk of dementia. We know that from many studies. And we estimate that if we could make sure that everyone was socially connected, no one was lonely, we would prevent about 5% of dementia cases in the world. That's a lot of people, millions of people. So, what does our research tell us? We know that loneliness is as bad for us as smoking 15 cigarettes a day. I know that it's shocking, but that's what the longest running happiness study in the world tells us. It is the Harvard study of adult development, which has been going for 8 years. Another finding from the Harvard study is that being socially connected delays the start of physical health conditions like diabetes, heart disease by 10 to 15 years. That means we get to live healthier for longer just by being connected to other people. The way I think about it is that social connection for us is a basic human need, just like food and water. Just like a plant needs sunlight to flower and grow, we need social connection. But we wanted to go a little bit deeper and actually answer the question of which type of social connections help us to stay healthy and just how much do we need. We looked at multiple aspects of social interactions, whether people lived alone or with others, whether they did community activities, did they have someone to confide in when they feel stress? Do they feel happy in their friendships and relationships? How often do they see friends and family? Are they currently in a relationship? And how often do they feel? And what we did was that we took data from studies that have followed people for a long time from all over the world. As you can see with the countries highlighted here in yellow, we had nearly 40,000 people, and we had data on their lifestyle, their physical health, how often they interacted with others. So we wanted to know what was going on. What we wanted to do was to see whether social interactions were important for our health, even after we took into account all the other risk factors for dementia that I've shown you previously. After all of this is taken into account, do social interactions still matter? But the answer is yes. In fact, being socially active reduces our risk of dementia by half. By half, even after taking into account all the other non-risk factors for dementia. You can see here the ones highlighted in navy were the ones that we found reduced our risk of dementia. Specifically, it was interacting with friends or family, and we found it wasn't even that much. It was even just once a month was enough to lower our risk of dementia. That's achievable. Having a confidant was really important. Being able to open up to someone when we feel stressed and not feeling lonely very often because we know how bad loneliness is for our health. So here are findings for dementia, but we also wanted to know what about lifespan? Do any of these social interactions help us to live a longer life? So we did another analysis with this data looking at what reduced our risk of early mortality. And the ones highlighted here in navy are the ones that matter. We live longer if we live with other people, if we do community activities, and we again have someone to talk to when we feel stressed. This is so important for our health. Well, we've talked about dementia, we've talked about lifespan, but what about mental health? As a psychologist, I care more about whether people are happy. So I wanted to look at that. And what we found was it was again this having a confidant, having emotional support that reduce our risk of depression and anxiety a few years later. Just to put that into context, it didn't matter if we got informational support, which is someone telling us which doctor to go to or how to do something at the post office. It wasn't having practical support, like someone doing our groceries or cleaning our house. It was specifically being able to talk to someone that we trust that mattered. So a lot of people ask me, are virtual connections good enough? I talk to my children or grandchildren or siblings or friends or other relatives in another city, another country. Is that good enough? And my answer is yes. We know that is good enough. It is quite good, but it's about half as effective in reducing our risk of dementia compared to actual face-to-face interactions. So why do social connections make us happy? We think is because of these two reasons, which we call bridging and bonding. Bridging is where we think connecting to other people allows us to do activities with them. And those activities, like let's say it's an exercise class or playing card games with them or walking groups, whatever it is, stimulates our minds and bodies and keeps them healthy and happy. The other aspect is bonding, which we've talked about quite a lot. It's having someone to confide in, having a close relationship with someone, which reduces our level of chronic stress. And we know that chronic stress makes the hippocampus, which is the memory center of the brain, literally shrink over time. So having someone to talk to means less chronic stress and good memories and a healthy brain. So, how do we maintain good social relationships? My favorite research in this area comes from John Gottman, who's a social researcher in the US. And he's built a house just for research where people move in, and he's got cameras in the living room. And he gets people to, do their morning routine, talk to each other, have breakfast, all of that, even have arguments while they're being filmed in the living room. And he gets his research team to code whatever they're seeing on video there. And he's followed them up for 30 years to see who is still together. And he can do that with 90% accuracy. I'm happy when I get 2% accuracy in a study. 90% accuracy is a lot. So, what did he find? He found that it was these four things that help people to maintain good relationships, whether it was in a couple or in other family relationships or with friends. It's positive comments. People who had good relationships had 5 positive comments for every single negative comment. And if they said any negative comments, it was usually between 2 positive comments. So it was a sandwich. Positive, negative, positive. Just like teachers do at school. They might say, Johnny is a very good boy. Sometimes he gets distracted in class, but I can see that he's trying really hard. Something like that. But in a friendship context, this is really important because what we see is that couples or friends who have good relationships make sure that there's only one negative comment there. So if you're thinking of a sandwich, let's make it a cheese sandwich and not a Big Mac. The second important thing was shared attention. People who had good relationships used shared attention at least 80% of the time. So, for example, if you're walking in a shop looking for something and the person that you're with says, "Oh, I really like that lamp," you don't just go and keep walking. You go, "Oh, I really like that style and color. I think it will really look good next to that new coffee table we got." It shows that you care. The third thing is humor. Humor is really important, especially to diffuse tense situations. So, people who had good relationships, even in the middle of a really heated argument, they would say something like, "I love you, but gosh, you can be such a doo-doo head sometimes." And just using that humor can diffuse all the tension in that situation. Finally, repair is important. Be the first to apologize and accept apologies. That's what helps us to maintain good relationships. But all of this is only possible if we're kind to ourselves. if we're down on ourselves, if we're critical towards ourselves, we will be critical towards other people too. So I want you to take 30 seconds. If you have a piece of paper around you, I want you to grab it. I want you to grab a pen or make a note on your phone. I want you to say one thing or write one thing that you do for your own self-care, whether that's listening to music, talking to a friend, going for a walk, whatever it is, enjoying a piece of cake, having a coffee somewhere. Do something nice for yourself today. I was taught that our mind is like a light bulb, which is why I have this picture up. If we have a happy light, a bright yellow light shining inside, it will also shine outside. So what happened to Joanna? Well, we did the same thing with Joanna. We asked her, well, Joanna, what makes you happy? What used to bring you joy before all of this happened? She said, well, I used to really like going with my best friend on little drives, little road trips, just random spots around Sydney. And I used to like doing photography. I said, well, where's your camera? She said, I don't know. I said, okay, your homework this week is to look for your camera. And she came back with a digital SLR camera. It was just lying around somewhere in her wardrobe. So what she did was that she went around, it was in Southwest Sydney at the time where I was working. She went around Camden, all the lovely cottages and rose gardens and other gardens there. She would take pictures of them. And she decided to call her best friend and said, hey, how about we restart that tradition of going on a little road trip every Saturday or Sunday? And so she started doing that. But even more impressively, she started volunteering. And that really got her out of her shell. She started to do something called a big walk that was organized to raise money for multiple sclerosis because her sister was affected by that. And her mood improved and her memory improved. So, what I want to tell you is that our mood affects our memory quite a lot. If we can improve our mood, often our memory can improve a little bit as well. But we often face a lot of barriers to social connection. So, for example, stigma. If we're living with a health condition or a condition like dementia, often we feel that we can't talk to other people, but it's possible to still lead a very full life and still have lots of connections. Often it's practical issues like transport, finances, which stop us. So think about some online groups or other groups that might be possible for you. But the most common thing that people tell me is that they lack confidence. Once they start losing confidence in their memory, they lose confidence in social situations. They say, Suraj, I don't know these people's names. I don't remember their faces. And even if I do, I don't remember what's going on in their lives or their children's names. And I just haven't spoken to anyone for so long. I just don't know if I can do it again. It's been 2 years since I spoke to anyone. So that's the main thing that we need to address, I think, is our lack of confidence. So, what are some strategies that we can use? If we've lost our confidence, it's important to ask ourselves, what's something I used to love doing? Tap into that joy to get yourself out of the shell. If you notice someone is a bit isolated, recommend doing at least one social activity a month. That reduces risk of dementia. But ideally, to maintain good mood, we know we need 2 social activities a week. It could even be a phone call. So start small. Even a phone call or a text is a good start. I suggest build in a reward. If you go somewhere, reward yourself with a coffee or lunch and encourage people to volunteer because when we help other people, it gets us past our social anxiety. My favorite study in this space compared people with social anxiety. One group got therapy with a clinical psychologist like myself, and the other group got to do volunteering. Guess who got better, faster, and stayed better? The people who were doing volunteering because purpose leads to happiness. So if you are a little bit isolated and you're looking for what are the local groups or resources available to me, there is a non-profit organization funded by the Australian government called Live Up. I've provided their website and number here if you'd like to jot that down, or you can just go to their website, liveup.org.au, and they have a list of local resources based on where you live, exercise classes, and local groups that you can join to get active. And this number, the 1-800-951-971, they have a navigator service to help you to connect to local groups. But a lot of people ask me, well, I've already got a diagnosis of mild cognitive impairment or dementia. How do I now stay socially active? Well, it's never too late. In fact, now is a really good time to make sure that we're being mentally, physically, and socially active. We did a study where we looked at people with mild cognitive impairment and dementia and what helped them to feel less lonely. And what we found was joining groups was a really effective way. So, walking, music, dance, reading, whatever you like. One thing that was really amazing to see was that music groups and dance groups were super effective, even when somebody had advanced stages of dementia where they couldn't speak anymore, because they could still participate in dance and music. And they still smiled and got animated and played music or moved around with the other people around them and just changed their entire week. So please, please, please stay active. So, if someone has a diagnosis of dementia, often there's a gap of information about what to do next. So, I've given you here a couple of info slides. So, firstly, at the Center for Healthy Brain Aging here at UNSW, we spent the last few years developing this website called Forward with Dementia. It has great resources that you can print off for people with dementia, for carers, and for healthcare professionals. So please have a look at the website. There's so many good stories and resources like how do I talk to my doctor about this? What do I do after a diagnosis? What supports are available? It's all there for you. Please use it. Secondly, if you are someone living with dementia or a carer for someone, please use the National Dementia Helpline. It's free. It's available 24/7 and it's run by the government. Doesn't matter what questions you have or if you just need to talk to someone. This is a great free resource for you. So please use this. It's 1-800-100-500. So I will use this chance to spruik our new study, which is designed to help you to stay socially connected, whether you are worried about your memory or whether you already have a diagnosis of mild cognitive impairment or dementia, it doesn't matter. You can be based anywhere in Australia. All you have to be is over 55 and have access to a computer or a tablet where you can join our Zoom social groups. And we will do a bunch of activities to help you to stay socially active. So if you are interested, please do sign up. You can either email me or call me, or you can use this QR code. I will just give you a couple of minutes just to use the QR code or write down my contact details so that you can express your interest in this study. And if you think this might not be applicable to you, but you know someone else who is a little bit isolated and would be someone who might benefit from joining this study, please do share the details with them. So our take-home messages today are social interactions are key to living a longer and healthier life. We know from our research that we need to see friends or family at least once a month, but more is better. And what's really important is having someone we can talk to, someone that we trust when we feel stressed. Remember that we are all in it together and we are each other's support network. So let's not leave anyone behind. And let's make sure that we start with small steps to increase our confidence in social situations. Now, one of the most important things you can all do today for yourselves is to stay informed. And at Chiba, we make that easy by sending out a monthly newsletter to keep you updated on the latest in brain health, research, as well as upcoming events. I would personally love for all of you to join the Chiba community. So if you're interested in receiving those regular updates by email, please subscribe by using this QR code on the screen now or by emailing chiba@unsw.edu.au. Thank you all for attending today. I hope you found this talk to be informative and uplifting, and we now have time for Q&A.
Thank you, Suraj. Thank you so much for that presentation.
So the question was, how much does virtual connection matter for our health? And the answer is it does help to keep our brains healthy, but it's about half as effective as face-to-face interaction. Having said that, my motto in life is something is better than nothing. So it's really good to keep in touch with your friends and family wherever they are around the world. As for most of us these days, we're global citizens. Our families are all over the world, so that's really important.
That's great to know. Thank you. And I know during COVID, certainly for younger people who stayed in touch with their friends, it was a very valuable form of maintaining social interaction for a lot of younger people. So look, Caroline's asked an interesting question too, Suraj. The value of solitude in your own well-being and being kind to yourself is sometimes very important for people, especially for those who might have had to isolate from their family for any kind of reasons or otherwise.
That's a really good question because personal safety, psychological safety is so important. Physical safety is so important. If you are in a situation where you do not feel safe, you have to prioritize your safety first. There's no question about that. What is important is if you are someone for whatever reason that needs solitude, whether you're just an introvert and need more time for yourself, whether you have a lot of responsibilities as a carer for other people around you, or you have a lot of responsibilities and don't get time for yourself, or whether there's other reasons where your safety is at risk, make sure you take that time for yourself. It's not about just being social all the time. It's about finding a balance that works for you. Uh, and it also depends what your personality is. I know the extroverts need a lot more social interaction because that recharges them. As an introvert, my solitude recharges me. So whenever I get a chance to just have a coffee, read a book, listen to music, that's my happy time where I feel that there is my battery recharging. And then I love interacting with people after that. When my cup is full, then I'm ready. When I'm positive, I'm ready.
I just want to mention something to everyone that I did mean to mention at the start. Suraj, you came to this field of work and study due to a very personal experience between you and your grandfather. Can you just tell us a little bit about that?
Yeah, this is very personal for me because my great grandfather had dementia. When I was 6, he was 90 years old. He was working very actively as a volunteer priest in the community. He'd go to people's houses and do prayers if they, bought a new house or had a baby or whatever it was that they were celebrating, or prayers for people who had passed away, whatever it was. And he'd walk 2 hours a day. He was super active. And then we moved house. And what happened was that he was so attached to us that he moved house with us, but he didn't know anyone in this new suburb. So he stopped his volunteering, stopped his walking, and very quickly went downhill from there. 6 months later, he couldn't remember things, couldn't recognize me. So that was really scary for me as a 6 year old because I didn't know why he couldn't recognize me. And then 6 months later, he passed away. So I always thought there was something about being socially active that keeps our brains healthy, because I saw as soon as he stopped being socially active, things changed for him.
Well, that's really great story to share with us. And boy, it sparked your professional interest in this, and you're now making the situation much better for older people as we age. Um, Somebody has said to us, once I suggested to someone in a DV situation, your safety, your health, your welfare, and keep repeating to yourself. The safety has been done, now they're working on the health and the welfare. So that's a great comment to have come into us. Suraj, we've got lots of people thanking you for the practical strategies that you've shared today. And we will just repeat that you're very keen to have people consider signing up for your Maintaining Social Engagement study. Where are you at in that phase of the study? What point are you up to?
So we are running social groups all throughout this year and next year, because this project does go on for a couple of years. So if you know anyone who's interested now or might be able to join early next year after Christmas break and all of that, please just encourage them to be part of this, because there's never a wrong time to be social. It's always helpful.
A couple of great comments here. Peter says, we need a reason to get up. And Vivian, we need purpose and anticipation as well as feeling being needed and relevant. And I think I sometimes bring to mind the saying that we all need someone to love, something to do, and something to look forward to. You're definitely a glass half full person, Suraj, aren't you?
I am. I think there's always something to be thankful for, I think. Um, a few years ago, I'd probably say I was more of a warrior and a glass half empty kind of person, but studying clinical psychology, doing all this has really helped me to change that perspective. And every single day before I go to bed, I write down three things that I'm grateful for. And that has been really, really helpful to make me more resilient. And a lot of research tells us that that's how we train our brain to be more resilient. So if you do that with someone, like tell a friend or family member every day what you're grateful for, that's really nice. And give back to the community. I think as we get older, our mind expands. We think more about the bigger picture, and that's where all our knowledge and experience can help other people. So in fact, the more we help other people, the more uplifted we feel.
So on that note, Pete is saying we sadly hear of young people who are being bullied and are self-harming. And while we're dealing with our own mental health and well-being and making sure our social interactions are good, how can we maybe be using this wisdom of the elders to help others communicate their distress in a meaningful and in a helpful way?
I think, as we get older, we have a natural empathy and an ability to sit and listen and be reassuring without judgment. In fact, my favorite study in this space is something called Friendship Bench. They trialed this in a country in Africa where they trained grandmothers to sit on a bench in the community and do talk therapy. And they compared people with depression and anxiety who went to a psychologist or counselor versus the people who went to the grandmother on the friendship bench. And guess who got better and stayed better? It's
Wonderful.
obvious.
That's a wonderful response and another good reminder that we can share our good feelings with everyone in the community. Gwen has says during COVID lockdowns, I shared each day 3 things I was grateful for, positive experiences with my Facebook friends. Many appreciated that and encouraged others to be more positive as well. Reshma says, thank you for sharing your thought about gratitude. Again, when we have good thoughts and healthy thoughts, we feel better, don't we?
Yeah, I think it's really important that we look after our mental health. Just as a clinical psychologist, I tell people make sure you do 2 physical and 2 social activities every week, and try to make one of those social activities where you give to the community, because that's so powerful. And if you are someone who's trying these things, but you still feel like you're feeling low or feeling isolated, please don't hesitate to talk to your GP. A lot of people forget that we can make a long appointment with the GP. They have a special code that they can use that is available for older adults, and please make use of that. And then you might need to talk to someone beyond that, which they can refer you to. A lot of people don't know that in Australia we can get a mental health treatment plan where we get rebates from Medicare for up to 10 sessions a year to see a psychologist. So it's all there. You pay your taxes, might as well use a rebate.
And I think the other takeaway for me is Joanna's story. So your advice to her to go and find her camera, and that's the spark to get her to recontact her friend. You mentioned music, Suraj. That's another way of really boosting your happiness and endorphins, isn't it?
Yeah, music is something that's so magical. I mean, I'm slightly biased as a music teacher. I teach children how to play piano and sing, and it's so much fun. Um, but the other thing is that music is the only thing that we know that exercises the entire brain. Learning a language, a new sport, all of that is really good for our brain, but only music, specifically playing a musical instrument, lights up the entire brain. So if you want a full brain workout, you know what to do.
Okay, everyone, you need to get your ukuleles out. Or recorders or whatever. Vivian makes a good point, and we know this from other research and studies. Older single men are more socially isolated. Perhaps women can be better at making new connections. Any particular tips for older men, Suraj?
Yeah, I see that a lot in the clinic as well. Women tend to have more distributed social networks and have lots of people that they've built over time, these friendships. Whereas with men, I tend to see that they rely on friends that someone else has brought into their life, or they might be isolated all along. So there's lots of groups out there that you can get involved in. I feel that as men, we tend to socialize more in parallel rather than facing each other. So try to get involved in a group where you can do an activity in parallel with someone else. So, playing a sport or going on a walking group or going to a men's shed. Things like that, or somewhere where you can tinker with something alongside someone else, because we tend to talk more openly when we're not facing the other person, when we're side by side with them.
Interesting. So another comment, what about social prescribing? Tell us a bit about that.
But this is an area that I'm super interested in because the US has it, Canada has it, the UK has it as part of the NHS. They actually have social prescribing navigators or link workers where the GP says, go see this person. And they say, you're isolated. Let's connect you to all your local groups. And that's been shown to be really effective in helping people come out of this low mood and loneliness. And I would love for that to be available here in Australia for everyone. As I mentioned, there's Live Up now, which is the non-for-profit organization through the Australian government. So please reach out to them if you are interested. Yeah.
Right, thank you. Well, thanks so much, everyone. We're getting to the end of our session today. So I'll just remind you that we've been speaking to Dr. Suraj Samtani. He's from the Uni of New South Wales Centre for Healthy Brain Ageing, and fantastic work going on there. We are so lucky to have these excellent research centres in Australia that are helping to build the evidence base for us and internationally. That's wonderful. Suraj's study is called Maintaining Social Engagement. And I did mention that we'll put all these details on our website as well. Liveup.org.au, we'll add that one in, and the National Dementia Helpline, as well as some information about how you can sign up for the centre's newsletter if you would like to do that. So thank you once again for giving us so much of your time today, Suraj. It's been wonderful.
Thank you. It's been an absolute pleasure to be here. Thank you for the invite. And I want you to all, just as a party comment, write down the name of one person that you haven't spoken to in a long time. And I want you to promise me in your own minds that you are going to call or text this person today.
Okay, everyone, that's our homework. So look, if we didn't get to your question, feel free to contact CODA New South Wales on our phone or email service. Our email again is info@codanewsouthwales.com.au. You can find all the details on our website, codanewsouthwales.com.au. I mentioned this recording will be available in coming days. It'll be on the website, and you will also get an email reminder that you can listen to it again. So don't hesitate to reach out, I think is another key message of today. And thank you, all of you, for putting your comments in the chat. It's wonderful to know that this is the kind of information that you really do want to hear. And as Suraj said at the start, we want to approach this topic from a strength-based position. Here's what we can do about something that is a really big social problem. So thank you. And do keep an eye out for your invitation to our next webinar event coming up in October. But thanks, everyone. We'll draw the webinar to a close again for today, and I do thank you for attending. Bye for now.